all know your commitment in relation to this, and that's clearly reflected in the significant increase that we've seen in the home help and home care budget, which has gone up by 58% since 2019, up to €700 million this year. And there's no doubt that the money is there. The difficulty is, Minister, that the hours are not being allocated that are being committed to. In fact, in 2023, there are just 59 additional hours a day being delivered across this country. That's 37 minutes additional home help support per day in each primary care network of a population of 50,000 people. It's loaves and fishes, Minister, and that's why we're in a situation where we have 6,500 individuals on waiting lists trying to access support, including some people that are in hospital at the moment. And look, the reality is, Minister, that there are increasing populations of people over the age of 65, and that's going to increase over the years. In fact, the CSO's census statistics have shown us that today there are over 1 million people over the age of 60. Close to 1 in 4 of those are living on their own. And we have a severe shortage of carers, leaving vulnerable individuals without the necessary support. And this is support that the HSE has independently assessed is required for these people to continue to live with dignity in their own homes, people with disabilities and older people. And this is down to a chronic shortage of home help hours, which is causing delays in discharging patients from hospital, particularly vulnerable older individuals, exacerbating the chaos that we have within those health facilities. And I accept, Minister, this is a complex challenge. It is not easy to solve, and I accept that. But, Minister, in the interim, can we at least, where we have allocated those hours, where we have the money available, could we not provide that to the families to use that money to buy in those services where they themselves can support carers? And this has been done in the past in relation to children with profound disabilities. Why are we denying it now to older people with disabilities? Why are we denying it to families with older people? And I'll give you one example, a case that I've spoken to you before about in relation to John and Mary, a vulnerable older couple living on their own. His wife requires full-time care, and while they've been allocated hours in the evenings and at weekends, they cannot get access to it whatsoever, and they're being denied it even though the money is there. They're being denied those supports. Or take Bridget, which the other Aristot, Minister Rabbitte knows this case very well. A middle-aged woman confined to a wheelchair after spinal trauma. She has been told that she is to go into a public nursing home during the day, 7 days a week, because there isn't home help available. Her husband will have to bring her in the morning. Her husband will have to collect her from the public nursing home in the evening, which is going against stated government policy, which is going against the Ombudsman report and the commitments that have been given by Minister Rabbitte not to put people with a disability into nursing homes. And yet, that is the solution that has been proposed to that family this week. Now, Minister, on top of that, we need to give family carers a break. We have 86,000 individuals across this country providing at least 43 hours of caregiving every single week. And these people are effectively being trapped in their own homes. They need respite. They need a break. And we're asking that that respite be put on a legal footing here, that every single full-time family care in this country has a minimum numbers of days respite available to them. And that is vitally important. Now, I welcome, Minister, the fact that this tender process is going on. I welcome the reassurances that you have given us in relation to what will be covered in that process. Can I get assurance from you, Minister, that in that tender process, the whole issue of travel, particularly travel in rural areas, will be addressed? Because, as we all know, the cost of living has gone up dramatically. The cost of transport has gone up dramatically over the last number of years. And yet, these people are being denied the basic levels of cost to cover their transport to and from the work that they're carrying out. And I want an assurance from you that that will be addressed. Now, Minister, you are correct in that quite a number of people have retired out of the system. But some of those people are prepared to go back and to do work, but they're being told by the HSE that their pension will be deducted if they do so under the pension abatement rules. And actually Bernard Gloucester before the committee recently reiterated that. But the reality is that the pension abatement rules were brought in for super well-paid, high-level civil servants. They weren't brought in to control the income of home helps. And Minister, I want you to take a leaf out of the book of Minister Foley. She got, as an exceptional measure, pension abatement brought in for teachers where there is a recruitment crisis in relation to teaching. Now, surely to God, Minister, if there's a recruitment crisis in relation to teaching, there's a recruitment crisis in relation to home help. So, Minister, the point I'm making is that the pension abatement rules are there in relation to that, and I would ask you to look at the flexibility with regard to that. Minister, the final point I want to make to you is that the Family Carers Ireland have come forward with a very innovative proposal to introduce a non-means tested participation income for family carers, to move away from the carers allowance altogether. They have put a very detailed proposal together. I would ask you to engage with them on that and get a commitment from government to establish a high-level group, interdepartmental group of senior civil servants to actually look at how we could implement this on a phased basis. And I commend the motion to the House.